So to begin with, could you share with us your background and a little bit about your journey to becoming a clinical psychologist?
So my personal background, I'm Cuban American, and so I think a couple of things that might be relevant. My mother was a social worker um, with the Cuban refugee program here in Miami. So I think that probably had some influence on me deciding to become a psychologist. Although it's not something I really set out to do in my youth. I majored in philosophy and religion in college. I didn't really know what I wanted to do. Actually, I thought I wanted to become an attorney, and uh, and then when I took the LSAT prep course, I decided I realized it wasn't for me, that career. So so after college, I did some work at social service agencies, and I kind of stumbled into a job as a counselor at a drug rehabilitation facility. So, and started from scratch as I went along, learning about counseling. That's how I really got my start in the field. It was from there that I decided that, I had to take a few courses in undergraduate psychology to to apply for the doctoral program. I decided I wanted to do a doctorate, and so I had to take a few undergraduate courses because I hadn't taken any in college. So, but the experience at the rehab, it was a very formative experience. They
Well,
taught us they taught us like about Carl Rogers, for example. That was
mhm,
my first exposure to Carl Rogers and client-centered therapy.
mhm.
And I got into therapy myself. So that was also a formative experience for me, seeing how you can actually try to help people with psychotherapy.
That's really interesting. So, were there any pivotal moments or experiences during your education or career that shaped your approach to mental health?
Yeah, there were, there were several. I mean, at the drug rehab facility, I was exposed to different ways of doing psychotherapy too. So we learned about Gestalt therapy. There was actually well, we would do groups and individual counseling, and there was someone who did Gestalt groups, and the treatment community that facility was a part of that tradition. It had all its own um, evolved way of doing therapy with clients. So I mean that was very formative. Um, I started learning about, I guess I started learning about psychoanalytic psychotherapy there from some of the things that I read, and then of course the undergraduate courses that I took in psychopathology and different realms of psychology. Um, and then graduate school, I got a broad exposure to different types of psychotherapy, cognitive behavioral psychotherapy, but the one that interested me the most from early on was psychodynamic or psychoanalytic psychotherapy. Because I had to write papers on some of these things, subjects like countertransference. So I had to read, I had to do research. We had different. It was at Nova. Uh,
Mhm.
we had different classes like social cognitive bases of behavior, and um, classes in all sorts of different subjects, or working with kids.
Hmm.
I mean, those were some of the early experiences, and in at Nova, I found a teacher who inspired me, um, Tony Ursita was his name.
Okay.
I was inspired by some of my teachers at Nova, also. He was one.
Mhm. That's so nice. So what does your day-to-day work look like? And what do you find most rewarding about it?
My day-to-day work. So I do psychotherapy and psychological testing.
Mm-hmm.
It's private practice. I think what do I find most rewarding about it? Um, I think it's something that you can help people to. I mean, my patients describe it in different ways, but one way is, you can help people to really learn to look at themselves like very deeply and without without the distortions, without the well, the defenses, the coping mechanisms, that distort the amount of, if you want to say, reality, or that allows that kind of filters the, I don't want to say the truth, but you know
Hmm.
that prevents people from being more aware of sometimes, like how they can contribute, how they can get in their own way.
Hmm.
I mean, if you can help someone do that, and that can have an impact on their life, how they manage whatever problem they're having, family relationship, work, or how they how they see themselves, how they feel about themselves. If you can make a difference in someone's life like that, that can be very rewarding. That's
Thank you for
probably.
sharing that. Yeah. Um, I was wondering, like you mentioned that you didn't know that psychology was for you initially, like you didn't go into this with psychology set in your mind. So I was just wondering, what advice would you give to students who are considering a career in psychology or mental health?
Hmm, what advice to give them?
Mhm.
I mean, I think the most important thing is to follow really your own interests. I mean, whatever it is that you're interested in. Um, Psychology, it's so rich, because like the part of it that colleagues and I are in it, it has all to do with understanding. It's like it's the science of subjective human experience.
Mhm.
Not only why people behave the way they do, but why people think and feel the way they do, and how those things give rise to behavior.
Hmm. Yeah, that's an
Uh,
interesting take. No, yeah, I've never seen it in that's a really nice perspective to look at it in. So thank you. Um, And you mentioned just recently, like, that your work integrates both psychodynamic and psychoanalytic therapy. And so, for students perhaps that are unfamiliar with these approaches, how would you describe their benefits compared to like other forms of therapy?
it's it's the attempt mm, to help the person achieve lasting change. It's not,
Okay.
you know, it's not a focus like on symptoms, which, a lot of the time has to do like with behavior. but it is an attempt to really go underneath whatever behavior, whatever you can see on the surface,
Hmm.
whatever the person is consciously aware of. It's not easy to do, because of course, because people need to not be aware for basically for regulating anxiety and depression. And people need to see themselves in certain ways. And so, dealing with people's coping mechanisms is like a big part of the job, making people more aware of those things. And sometimes helping people maybe find more constructive coping mechanisms. But it is the field of study that Freud started
Hmm.
a very long time ago, and that has been developing for what 140 years roughly now, something like that. It's become much more relational, much more about using the relationship, the therapeutic relationship.
That's interesting. Thank you for sharing. Kind of shifting gears a little bit. So conventional Western therapy often doesn't really take the variability of immigrants and their cultures into consideration. And you have experience working with diverse populations, including low SES and immigrant communities. And so, how do you think that culture influences mental health treatments? And why do you think that what do you think that experts should keep in mind when working cross-culturally?
Yeah. Yeah, that's a good question. It is something you need to keep in mind. I mean, certainly here in South Florida, where we have so many people who descend, if if they don't come themselves from Latin America.
Hmm.
So um, I do have one patient, who talks to me about this subject often in regards to what he came for help with. He's from Venezuela, and he often tells me about how he feels about certain beliefs that people have about relationships are like very culturally dependent. So I mean in general, you need to keep those things in mind because they're important to people you work with, to patients. But I think, you also need to keep in mind, of course, how like something like that can become a like a kind of shield, for the person not to look at themselves as deeply as they may need to. Humans, we can hide behind all sorts of things, including justifying that certain ways of thinking about or certain ways of behaving are culturally acceptable. Um, but so I mean, that's an issue that comes up a lot with people.
Yeah, no, I completely understand. Thank you for that.
So in your work, you stress the importance of addressing internal pain by reflecting and understanding it rather than carrying it as emotional baggage. So for students hesitant to seek mental health support, what would you suggest to encourage them?
I think I would say, I mean, like with anyone, you try to understand like what prevents the person from getting the help they need. You know, you try to understand it, which is often, based on distortions that the person has. I mean, for instance, like for men, it especially that, it may be hard to ask for help, harder than for a woman to ask for help. Often it has to do with worries about being perceived as being weak or feeling weak. The underlying kind of beliefs about masculinity may be that that there's an emphasis on self-sufficiency. So that, I mean, that's just one example, but people can have all sorts of different concerns. And sometimes if you can address the concerns,
Hmm.
you know, you can overcome those barriers. So it's not
Hmm.
something you hear a lot about anymore, but I mean, people used to say back in the day, oh, going to see a mental health professional is for crazy people. It's obviously not. That was one kind of distortion. That was a barrier for some
Hmm.
people. The stigma, the
Yeah.
stigma of it.
Um, and shifting to like students and their mental health, many students struggle with balancing academics and work and personal life. So, could you share some effective strategies for managing stress and avoiding burnout?
For managing stress. Yeah, well, I mean, stress, I guess essentially anxiety,
Hmm.
I suppose. But um, I mean, I think the typical things that help people often are exercise, meditation. I like meditation, I've always liked it because it's in some ways it's similar to psychotherapy.
Hmm.
It doesn't help everybody. Not everybody can really get it to take, if they attempt to practice it, but I mean, mindfulness, meditative practice, it is certainly about observing what's in your mind and not judging what's in your mind and trying to accept what is in your mind as much as possible without becoming too frightened of it, which takes practice. But that's
Hmm.
certainly, so that's a kind of exposure therapy, sort of. You're allowing, you're trying to cultivate an openness to the contents of your mind, thoughts and feelings, fantasies, whatever. Um, that certainly helps some people, meditation.
Kind of jumping off of that, are there any simple daily habits or like mindfulness techniques that maybe can help students maintain their mental well-being? Let that be like short-term wise or perhaps long-term wise.
Habits. I mean, I would think certainly being in this field. I was telling this actually to this patient from Venezuela yesterday. I think probably the most important thing is to be open, like to learning about yourself. It's not easy to do because, people always have problems with something that they're experiencing, some kind of reaction they're having, or but depression, anxiety, they don't want to feel a certain way, they want to feel differently or behave differently, or you know so they're people are essentially like often trying to get rid of some part of their mind. But again, like with meditation, it's really the kind of cure is like cultivating an openness to curiosity and openness and ultimately acceptance, self-acceptance, which is, it's not easy to do. It takes a lot of practice.
No, yeah, it does. Completely get it. Yeah. Thank you. Thank you for that. And then also jumping off a little bit from that as well, if you could give maybe one piece of advice to students who are struggling with their mental health, what would it be?
Hmm. Um, I guess I would say, I mean, don't be afraid to reach out to someone. You can't do it yourself. I mean, you know, I forget what the saying is that we use. It takes two minds to understand one mind. You know, um, it's not something. Freud was really the only one and who analyzed himself, and who didn't have a therapist. I mean, he was the founder of psychoanalysis. So, and and he was not perfect by any means. So, um, but yeah, don't you know, don't be afraid to reach out. I mean, there's a lot of help available, really, in different ways.
Yeah, thank you. Um, just one last question regarding your background in specifically the addiction treatment. So do you see any like emerging trends in substance use or of behavioral addictions among young adults that universities maybe should be aware of or that you think that they should be aware of?
That's an interesting question. I don't see, I mean, I do see some, I do work with a good number of young people, adolescents and university students. I'm close to the University of Miami, so sometimes I see students from there.
Hmm.
Emerging trends. That's interesting. Not that I have personally encountered it, but what I have been wondering every time I see an ad for gambling, sports betting and gambling. From the little I have heard about that sounds like an emerging trend, certainly for young people to be very careful with because it's become so much easier and so accessible.
Yeah.
So but it's not typically something that I deal with.
No, yeah. But thank you for sharing your thoughts and your insight on it. I appreciate it.
So in your years of practice, have you encountered cases that illustrates the impact of environmental stressors such as war or political divisiveness on the mental health of students? And how do you think these factors affect students and the field of mental health as a whole?
Yeah, I was a staff psychologist at Cambridge Hospital in Cambridge,
Mm-hmm.
Mass, for about 10 years on the Latino team. And that's
Mm-hmm.
where I came into contact with a lot of what you're describing,
Mm-hmm.
because we had a lot of patients from like war-torn Latin American countries
Mm-hmm.
who had fled their countries of origin. So like El Salvador
Mm-hmm.
or Nicaragua or Honduras. So, they had fled poverty and a lot of political turmoil and
Mm-hmm.
instability. Sometimes women fleeing sexual violence or
Mm-hmm.
um, so yeah, I mean, all of those kinds of experiences. I mean, sometimes, one of the diagnoses that some of our patients carried would be post-traumatic stress disorder.
Mm-hmm.
So um, yeah, very, very difficult situations, to help someone with being
Yeah.
like, for instance, being in Boston, like very far from home,
Mm-hmm.
from other family members,
Yeah.
dealing dealing with multiple issues like housing and employment and um, and prejudice.
Mm-hmm. Did you come across students when you were working there who were refugees or um, immigrants from different countries that had the same experiences that you talked about?
Students, not so much.
Mhm.
because I worked really with adults at that point.
Okay.
And not so much, I mean, I would see students from some of the universities there,
Mm.
but who did not have those kinds of issues for the most part.
Okay. Thank you for sharing that. So, to wrap up, what is one lesson or mindset that helped you in your career and life that you'd like to share with students?
Oh, one lesson from my career.
Mhm.
You you guys ask really good questions. I mean, to me, it's just, it's really just kind of all about following your intellectual curiosity wherever it leads you, and not, you know, it's kind of just that. I mean, it's very simple in a way, but um, just believing in that, in your intellectual curiosity, and following your experiences wherever they take you. Your personal, your professional experiences as well as your personal
Mhm.
experiences. To me, it's just kind of all about that.
Thank you. That's really great. So yeah, that's all the questions that we have for today. Thank you so much for taking the time to be with us here today, and answering all of our questions. We really appreciate that.
Well, my pleasure.
Thank you.
Okay, Alice. So we're all set then for today.
Yeah.
Yeah, we're all set. Perfect. And if you ever want to reach out to FEU Thrive in the future, or perhaps would like anything at all, truly, please reach out, and we don't mind reaching out to you as well. So we truly want to thank you and appreciate the time you spent with us this morning. And I hope you have a great rest of your day. Truly. Thank you.
Thank you. Likewise. Good to meet you guys.
You too.
You too.
Okay.
Thank you.
Bye-bye. Bye.
Bye.
Bye.